Good morning, people. Bienvenidos here. Here's a breaking news. Yeah, findings support a more cautious approach to making early decisions on withdrawal of life support following traumatic brain injuries. Yeah, severe traumatic brain injury, that is called TBI, is a major cause of hospitalization and deaths around the world, affecting more than 5 million people each year. Predicting outcomes following a brain injury can be challenging, yet, families are asked to make decisions about continuing or withdrawing life sustaining treatment within days of injury. In a new study, Mass General Brigham investigators analyzed potential clinical outcomes for TBI patients enrolled in the Transforming Research and Clinical Knowledge in TBI study for whom life support was withdrawn. The investigators found that some patients for whom life support was withdrawn may have survived and recovered some level of independence a few months after injury. These findings suggest that delaying decisions on withdrawing life support might be beneficial for some patients. Families are often asked to make decisions to withdraw life support measures such as mechanical breathing within 72 hours of brain injury. Information relayed by physicians suggesting a poor neurologic prognosis is the most common reason families opt for withdrawing life support measures. However, there are currently no medical guidelines or precise algorithms that determine which patients with severe TBI are likely to recover. Using data collected over a 7.5-year period on 1,392 TBI patients in intensive care units at 18 United States trauma centers, the researchers created a mathematical model to calculate the likelihood of withdrawal of life-sustaining treatment based on properties like demographics, socio-economic factors, and injury characteristics. Then they paired individuals for whom life-sustaining treatment was not withdrawn to individuals with similar model scores but for whom life-sustaining treatment was withdrawn. Based on follow-up of their WIST period counterparts, the estimated 6-month outcomes for a substantial proportion of the WLST plus group was either death or recovery of at least some independence in daily activities. Of survivors, more than 40% of the WLST group recovered at least some independence. In addition, the research team found that remaining in a vegetative state was an unlikely outcome by 6 months after injury. Importantly, none of the patients who died in this study were pronounced brain dead, and thus the result were not applicable to brain death. BNDA's exclusive report.